Hi, I'm Paul Duberstein. I am professor and chair of the Department of Health Behavior, Society, and Policy at the Rutgers School of Public Health. And today I'm here with Dr. Mike Anestis, who is the head and executive director of the New Jersey Gun Violence Research Center and an associate professor in the School of Public Health. And we're going to talk about firearm violence and suicide. There's been a report of a surge in firearm purchases since the onset of this COVID pandemic. How is that related to suicide?
So we know a lot of things about firearms and suicide, even though I really wish there was more research on the topic. And some of the things we know is that when there's a firearm in the home, the risk for suicide is 3 times higher for everybody who's in that home. And then if you store the firearm less safely, that risk goes up even more. So if there's a surge in purchasing during COVID, and based off just FBI data on background checks alone, it seems like there's a 40 to 60% surge just from last year alone. If you see that surge, that means more people have access to the most lethal method for suicide. And so as a suicide researcher, as someone who focuses his whole career on suicide prevention, that leaves me concerned that more people who are out there struggling have access to the most lethal method for suicide.
Are you saying that firearms cause suicide?
No, definitely not. And there's a strong research base showing, in fact, that firearm owners are no more likely than anyone else to think about suicide. So it's not that the act of going out and acquiring a firearm takes someone who's otherwise happy and makes them think about suicide. That's just not how it works. But what happens is that if someone is suicidal and they have access, the risk that they're going to die goes up dramatically. And what makes that particularly complicated is that we're not all that good, quite frankly, at knowing who is and who isn't thinking about suicide. People often aren't waving their hands and saying, hey, I'm having a hard time. And so there's an unknown number of gun owners out there who now have access they might not otherwise have had.
The surge in firearm purchases is worrying. Why do you think that is? Why has there been a surge?
So obviously, in the midst of the pandemic now, we don't have definitive answers on that. Science moves pretty slowly on those fronts, but there's early data out there. And what I've seen makes it seem that the primary reason for a lot of folks purchasing firearms during COVID or considering buying firearms during COVID is that they're anxious. The world is dangerous. People are dangerous. There's uncertainty. COVID has been stressful. There's economic stress, and they're not sure how things are going to go. And so the firearm becomes a tool for safety. It's a way to keep themselves and their families safe, not from a specific threat in their neighborhood. So the folks who are purchasing aren't reporting that they live in a more dangerous neighborhood. So it's not that, wow, crime's gone up, I'm getting a firearm because I need to adjust to the reality around me. They're more of an abstract, I'm anxious, and the world is in a tough moment, and I'm having a hard time. And in fact, we're seeing a lot of firearm purchasers in our data who have lifetime experience as military personnel or law enforcement or first responders, folks who are, I think, a lot of times more on the front lines of what's going on a day-to-day basis, and perhaps are feeling very stressed out about it. And so they're turning to firearms as a tool.
Okay, but if it's a tool of safety and protection, how would it be used in suicide?
So
it doesn't seem intuitive.
Yeah, and it usually isn't. So most firearm owners will say, hey, I've never been suicidal, I'm not suicidal now, I'm never going to become suicidal. And they're right. Most people don't, right? The issue isn't that a huge percentage of firearms are used in suicide deaths. It's that risk goes up. And that the way risk goes up, in part, is through behavioral decisions people make that aren't in their best interest. And I'm speaking specifically about how they're stored. When the most common reason for purchasing and maintaining a firearm is protection at home. And so if you ask a firearm owner, are you storing your firearm safely? A lot of times they'll say, yes, I've got it loaded under my pillow on the ready in case someone comes in at 2 in the morning. I don't have time to go find it and load it. That's an immediate threat I need to take care of. And you can understand that perspective, but the problem is that's not typically how things go. As a firearm suicide prevention specialist, I think about safety as storing firearms unloaded, separate from ammo, in a secure location like a gun safe or a lockbox, because the firearm is simply more likely to be used in a suicide attempt than it is in protection from a home invasion.
So we know that men in general are at greater risk of death by suicide than women, and suicide rates increase with age. Are there particular groups of people who are vulnerable to firearm suicide?
Absolutely. Older adults would be one of those groups for sure. Men in general, older men in particular, people who live in rural environments, people with military experience, people who have had time in professions that involve training in firearms. It's these groups of folks, and what's unfortunate about it is it's not just that they have higher rates of firearm ownership and experience and comfort, so they know how to use this method. They also tend to be groups that are less likely to seek out mental health care or to tell you if they're struggling with thoughts of suicide. So on the one hand, people don't picture them when they think about suicide risk. That's not when people close their eyes and think about a suicidal person. They're not picturing a 65-year-old retired service member, right? That's not what's going on in their mind, but it probably should be. And those folks often aren't overtly saying, I'm having a hard time, and they're not seeking out help. And on top of that, they're more likely than other folks to have a firearm. And because they're comfortable with it, they're more likely to use it. The most common method is overdose. We've all taken medicine. We know how to use that. We can picture that. Other folks have that same level of experience with firearms.
So you mentioned there are certain professional groups that may be at particular risk because they have access to firearms and have firearm knowledge. What are those groups?
Yeah, I would think about things like law enforcement, like military and military veterans, first responders in general, anybody who would have any sort of training or access to firearms in their professional life. And I think it's important to note that this same idea extends beyond firearms, right? So there's research about veterinarians being more likely to use phenobarbital. They're trained to use that, right? Or anesthesiologists using the same type of medication they would use in treating patients. And so the idea is that people use what they are familiar with, because suicide is a difficult, sort of daunting task. And when people are picturing what this would look like, they picture using something that they understand what it is. And so certain professions simply have more exposure to and comfort with firearms. And so when they think about what suicide would look like, they think about that. And unfortunately, that particular method is so much more lethal than just about any other method. It leaves them particularly vulnerable to dying by suicide.
Earlier you said something that I thought was very interesting, that some of these individuals don't feel comfortable seeking help. Can you elaborate on that? Why would that be?
So I think it could be a number of things. Some of it is sort of cultural values, sort of masculine norms. There are a lot of things. If you think of the military in particular, people will talk about the warrior culture. And the warrior culture involves a lot of things like autonomy and solving your own problems and stoicism and suppression of emotions and projecting strength so that you're not a liability to the rest of your unit, that you are functioning as part of the group and able to fulfill your mission, right? And so if you are sort of working and living those values on a day-to-day basis, and you start to feel something like, I am weak and I am hopeless and I'm thinking about suicide, it's going to be hard for you to come forward. And then on top of those sort of cultural barriers, in some professions there are logistical ones too. So think about a law enforcement officer or a service member. If they report they're having thoughts of suicide, are they going to lose their weapon? Are they going to be put on a desk job? Are they going to be separated from their buddies and their community? Are people going to trust them less? Is this going to create a career advancement barrier for them so that financially they are further from retirement, they can take care of their family less? They're already feeling like a burden. That's a lot of risk for them to take on. And so you've got this mixture of cultural and identity barriers and then logistical barriers that just make it harder for some of these folks to want to or even be able to seek help for what they're experiencing.
Right. So with these significant barriers to help seeking, what could we in public health do about this?
I think there is no one single answer, right? And so I'll answer from the firearms perspective, and without giving the impression that this solves all of it. But the most successful methods we have at preventing suicide across the globe are ones that involve what we call means safety. So taking a method for suicide and making it either less deadly or harder to access for a suicide attempt. And so we've seen this in the UK. They detoxified domestic gas. People used to stick their heads in the oven and die by suicide. In the UK, they detoxified the gas, and people essentially were unable to ever do that. And the national suicide rate there went down by 30-40%.
Wow.
You saw the same thing in Sri Lanka with pesticides. They banned the most lethal brands of pesticides, and the overall suicide rate in Sri Lanka went down by 50%. You take the method that in a specific area is so particularly common and highly lethal, and you change its availability. Now, that's probably going to sound to a lot of folks like a gun grab. And I'm saying, well, overturn the Second Amendment and get rid of all the firearms. That's not what I'm saying, and even if it was, it would be unrealistic. It's not going to happen. So what I'm saying, and from a public health perspective, is we need to work to shift cultural norms around two things. One is safe storage at home. So get folks to embrace the idea that firearms are associated with suicide risk, and so you can take simple steps to store them safely, unloaded, separate from ammo in a secure location, without threatening your identity or your rights or your family. And the second is having legal channels to voluntarily and temporarily store firearms away from home during times of stress. The same way you give your buddy your keys if you've had too much to drink, and then you get them back. there's got to be a legal way for folks to be able to temporarily store away from home, or at least store components like the firing pin away from home, so that the weapon is no longer functional for that period of time, at least not for that individual, until they are ready to get it back.
So you mentioned changing norms as a way to modify the problem of firearm suicide, but changing norms is hard, isn't it? I guess we do have the example of norms around tobacco. That's changed dramatically here in this country and around the world over the last few decades, but how are we going to change norms around firearms?
Well, step one is going to be collaboration. And so I think that there's a long history of animosity between firearm owners and non-firearm owners. So it becomes a conversation about the Second Amendment. So we have to shift the way we talk about firearms and with whom we're talking. So this isn't a call to pander to people, and it isn't a call to deny data, but it's to say that the perspectives of gun owners need to be included, because you won't solve firearm suicide without them, right? And so this involves thinking about messaging, for instance. Who do folks want to hear from, and how do they want to hear from them? And in what medium do they want to hear from folks about safe storage? How will that resonate? What types of messages and from whom will actually prompt sustained behavior change? So it's a matter of working with the communities. And so many of the interventions we have in public health involve working with the community we're trying to reach, and as opposed to imposing something upon them. Instead, collaborating, working with them on the ground to get folks to see things differently, right? That, I think, is a big part of it. And some of that's fairly abstract, right? How do you implement that? I think part of it is basic science, again, studying messages and how people respond, and part of it is relationship building and just bringing people to the table on the front end of research design to say, hey, how does this reflect your experience in this community? What questions do you think we're not asking? And how does this seem to or not seem to reflect your views on things?
So what are the groups or constituencies that you think need to be at the table, need to be part of the conversation?
So again, it's a lot of guesswork. We don't really know. The little bit of data that's out there on who people want to hear from consistently circles back to military and military veterans as a group of folks, and actually specifically away from healthcare professionals and celebrities. So a lot of the folks who end up being most vocal on these issues, whether it's through social media or through public health campaigns, aren't necessarily the credible messengers we need on this. What we need are folks who themselves have been gun owners, and that's been a part of their identity as who they are, to speak about this, because it's less likely to be perceived as having an angle, as being a gun grab, and more a perception of what it truly is, which is just trying to prevent people from dying, which actually I think there's pretty uniform support for, right? Nobody's wanting anyone to die by suicide. The disagreement is on whether safe storage is relevant to that at all. And I think for a lot of firearm owners, they feel like it's not. And if it isn't, then why would they change their behavior? I think the data show pretty clearly that it is relevant. But me saying that is not convincing. So whether that's military veterans, whether that's gun shop owners, it depends. But it's got to be somebody who cannot possibly be perceived as simply being a liberal coming to take the guns away.
Right. So that's interesting. So you're talking about individuals, like individual members of the military, but what about groups, organizations, other constituencies, like corporations?
It would depend on
organizations like the NRA.
Yeah, and that's a tricky one, right? So the NRA does do some work with suicide prevention groups, and so does the National Shooting Sports Foundation, NSSF. And then there's some value in what they're doing. We haven't really been able to assess how effective they are, but you see collaborations between some of the top researchers in the field and NSSF in particular, working to speak to gun shop owners or gun ranges about how to promote safety amongst their gun owners or among purchasers. And I think there's a lot of value in that. We have to see to what extent do those efforts result in actual behavior change, and to what extent do those efforts come with any compromise on also advocating for legislation that is supported by data but is not necessarily consistent with the goals of a lobbying group. And so it's tricky. You need a large group that has credibility and a big podium, and lobbies fit that. But you also need a group that's going to truly embrace the idea of data-driven decisions. And if some of the suicide prevention approaches aren't necessarily good for the bottom line, that could create a little bit of a conflict of interest there.